Hi, my name is Jim and I was retired. Here's a short added video this week about getting ready for Medicare in 2023. Now, yes, I already have my Medicare, but for those baby boomers that are just following me and turning 65 in 2023, here's a little bonus tip. The initial enrollment period is going to be a little less onerous if you wait until the final 3 months of your initial enrollment period. Let me explain. The initial enrollment period includes the 3 months prior to your birth month, and the 3 months following the birth month. Now, the old regulations that I had to follow was that if you applied in the initial first 3 months of your period, you were guaranteed to get your Medicare starting on the first of your birth month. If you registered for Medicare in your birth month, it would start the month later. If you waited until those final 3 months, it could take up as long as 3 months to get your Medicare if you waited for that last month. Well, all of that has been changed. It's now a little less onerous to wait. So now there's less delays for delaying. If you register in the before the month you turn 65, your Medicare will start the month you turn 65. If you wait the month you turn 65, it'll be the next month. And in any of those 3 months after you turn 65, if you register, it will always start the next month. But I'm going to suggest that you go ahead and register in those first 3 months. And as a reminder, as you enroll for Medicare, you'll make a fundamental choice between original Medicare Parts A and B or a Medicare Advantage. Those are all the plans. The Advantage plans are the ones that are heavily advertised during this annual enrollment period. They combine Parts A and B, run it by a private insurer, and may include a Part D prescription drug and other benefits, including dental and vision. But it's run by a separate insurance company. It's no longer your original Medicare Parts A and B. Now, if you select original, you can add a Part D prescription drug plan, as well as a Medigap or supplemental coverage that will pay for the parts of Medicare that Parts A and B don't cover. And that includes all the deductibles with the exception of a Part B deductible that you must pay. To sum up, there are some advantages of original Medicare Part A and B and some advantages of Medicare Advantage C plans. A and B, the original Medicare, costs more than Advantage, but you'll have more predictable costs. And there's no network of doctors. You can go to any doctor that accepts Medicare. And that means you're free to travel in the United States. Whereas if you're in a Medicare Advantage plan, some of them may be free, but you'll have copays and deductibles that could add up. And an Advantage plan, like an HMO, will limit your plan's network of doctors and hospitals, and generally only in your home area. So as you travel around the United States, you may need to go home to get your health care. So as you're signing up for 65, you'll sign up for Part A, which is your hospital insurance. You've already paid for that through your payroll deductions, your payroll taxes in your working career. Part B will be paid quarterly or through a easy pay monthly direct bill from Medicare or deducted from your Social Security benefits. Part D prescription drug plan will be a separate plan from an insurance company, and you'll pay a premium for that. Medigap is also a separate insurance company, and you'll be billed monthly for that insurance. There is a period of guaranteed issue with no medical underwriting during your initial enrollment period or a special enrollment period. And they're also, depending upon the size of your employer's plan, you definitely want to sign up for A and maybe B because it'll coordinate with whatever insurance you're carrying. If you make a mistake and miss these opportunities in an initial enrollment period or a special enrollment period, you may have to pay a late penalty for Part B and Part D coverages. And you also want to make sure that you're looking at your income from 2 years ago, because if it's too high, you may be paying IRMA charges. And those are added premium charges based on income, but they measure it from 2 years ago. All right, that's my short update for 2023 enrolling for Medicare for those younger baby boomers that following me. I'm going to add this to my playlist of getting ready for Medicare with the new updated initial enrollment period changes. Now, I should add that I am not an insurance broker. I am not a financial planner. I have no initials after my name. So take these as entertaining ideas from one educated consumer to another. Always do your own due diligence and seek out a professional if you need one. Thanks.